Okay, so I think we're good to go. So good evening, everybody. Glad you could all make it tonight. I can see there's some vet colleagues on here too, which is great. Hope you guys are all well. My name is Ross. I'm a vet with quite an interest in reptiles and parasitology. So today I just wanted to share with you what we do and why we do it relating to reptile parasites in the UK. Okay, so parasitology is the study of parasites, their hosts, and the relationship between them. Parasitologist, you could say, is someone who studies parasites, usually has a bachelor's degree in science, PhD, postgraduate degree. My own experience is as an exotic animal vet with a passion and interest mainly in reptiles and reptile parasitology. I've been doing this for approximately 10, 11 years. It's evolved gradually into, my clinical work has evolved gradually into parasitology laboratory work. It's my main focus. And I actually found parasitology hard to study at university. It was a challenging subject for me. I didn't particularly like it. It turned out to be now one of my main interests, quite bizarrely. So who actually wants to look at feces all day? What I did, and I used to do it mainly initially because nobody else really wanted to do it. And I found that it was quite a mysterious, relatively unknown field, constantly growing. As more research takes place. Actually started even taking samples, well, for many years home, trying to perfect Cryptosporidia stain in a spare room. Then it progressed into a garage. Once my daughter came along, just from a health and safety point of view, seemed to be the right thing to do. I had neighbours that thought that I was crazy, up to no good. Even had the police around one day, so that was quite interesting. And the interest just grew. And when I was in clinical practice, seeing sick reptiles with high parasitic loads, often causing disease, the interest just grew. Soon found that the significance of the findings had to be based on the whole clinical picture. When we started to actually dig deeper, finding out why many of these reptiles were actually sick. So often they'd have secondary parasitic disease, not as a primary cause, but they'd have underlying disease. For example, you see quite a few bearded dragons that tested more and more for adenovirus. They carry coccidia, maybe high numbers of pinworms, but it wasn't actually the actual cause of what we were seeing in these reptiles. So some of the parasites are quite pathogenic and cause disease. And some often non-harmful parasites can cause disease if there's very high numbers, and if there's symptoms, maybe they should be treated. But what we generally see is that disease is often a secondary cause. So the procedures to actually perform, so we normally start with direct wet mount, which is just a sample, fecal sample on a slide with a cover slip. Some saline solution can increase the movement of some of the small parasites, flagellates, for example. The light can stimulate them too. We do lots of flotations, different types of flotation. Centrifugal flotation has been proved to be with a higher sensitivity, and there's different solutions that we use for different parasites, from sodium nitrate, sucrose, for Cryptosporidia, for example. With the sediment at the bottoms of the heavier eggs, we normally examine that too, and we don't really find many in there. We do inside the wild reptiles. And then with the pinworms, we generally do pinworm counts. So the pinworm counts is quite a subject. We'll talk about that a bit later on. But we normally use a modified McMaster's, which just counts the number of eggs per gram. We do quite a lot of staining. Mainly initially it was for Cryptosporidia. As on Nielsen stain, modified Kinyoon stain now. We changed all the times and we sort of perfected that stain, I believe. We use antibody tests for Giardia and Crypto alongside staining. We also have the cats and dogs and IDEX Pet Check ELISA technology test, which doesn't just pick up eggs, it can pick up adult parasites that aren't actually shedding eggs. And that's obviously dogs and cats to do with the reptiles. And equipment-wise, it's obviously microscopes, trinocular microscopes with cameras connected, infinity lenses are the newer ones we've recently purchased, fluorescence microscopes, They're the most recent ones we have now for, again, for a different type of cryptosporidia diagnostic testing. Cameras connected, obviously, to computers. So yeah, it's quite a setup that you need initially to actually do a good job in detecting some of these parasites. So the worm counts, the count and significance is for very often there's lots of roundworm eggs that just by seeing a few can be a problem, especially a small reptile. They may need treatment. Smaller parasites like pinworms, for example, there may be high numbers, but just their mere presence does not suggest that we need to treat. Worm counts are very interesting, and they're widely used in equine parasitology, but there are no current, there's not much science behind the accepted values for worm count in reptiles, and for worm counts are more precisely pinworm counts. Often the numbers are extrapolated from equine, which they don't appear to be anywhere near those in the reptiles this is compared to equine pinworms. There's Joe Headley at the Royal Veterinary College. He did some work on parasites and tortoises that hadn't had any sign of disease for the last year, and the numbers are actually quite high, very different to those found in horses. And yeah, they were a lot higher than a lot of the laboratories' reference ranges will actually give, but there's a lot more research needed, and that's part of our main focus. Is the actual significance of pinworms. I think there is a change. There is a paradigm shift, if you like, in reptile treatments currently. And pinworms can be an issue, but they do have a direct life cycle. They will usually increase pretty quickly once they're present, and they will depend on the environmental load and the husbandry conditions. And in rare cases, they can cause disease. Repeat in rare cases. Years ago, when I worked at the Tortoise Hospital for a few years, we didn't see hardly any tortoises at all with symptoms. With pinworms, there was more often underlying disease. So rare cases, yeah, there have been reports, but it's not the norm, and you just got to be cautious. As the treatment for pinworm shouldn't be seen as, well, a tortoise has worms, so I need to treat them because they're horrible, and that could be dangerous. It can be dangerous. And the main reason behind this is that the benzimidazole, which includes the most commonly used drug, say Panacur, fenbendazole, it's the way it works. It actually binds to tubulin, which interferes with the dividing cells or the cells in mitosis. That's how it works on the parasites, which is great, but it also affects the dividing cells in the reptile, affecting mainly the gut and the bone marrow. So the so-called pancytopenia, which can happen, which are decrease in the white blood cells, obviously affecting immunity. It can lead to severe immune suppression with subsequent bacterial fungal infections, which can then be life-threatening. And if these reptiles do have an underlying disease, virus, for example, that can be a big issue. Whether it's a tortoise or a beta dragon with adenovirus, it can be a major issue. It can be life-threatening. So just got to be very cautious. The study was actually performed in Hermann's tortoises, so 6 Hermanns, and it showed that they had extended reduced white blood cells and change in other substances in the blood as well. So glucose was affected, uric acid. They were the main ones where there were changes, and it actually lasts quite a few months as well. So from memory, I believe it was 120 days approximately. So that's based on that study and many previous anecdotal reports. I've had no end of tortoises, many tortoises where they've been treated with the low end of fenbendazole, and then bloods have shown very low white blood cell counts. So that's anecdotal, obviously, but that's put together with the study. It just shows that we just has to be carefully considered, the actual treatment, and only used if necessary. And it should be a risk assessment. If you've got a tortoise, say, going into hibernation in a month, 2 months, and there are pinworms, whatever the number is, whether it's a considered moderate or low burden, do you really want to dose them with a drug that can cause immune suppression and could could start a viral problem, and they can show symptoms, and probably not. So it's, you just got to be cautious. It is a risk assessment, and your reptile or exotics vet is really the person to go to. That's a discussion with them, a conversation with them, and the signs, the symptoms that are being seen, the history, and the husbandry conditions. That's something that will be taken into account, and then a decision obviously will be made. The types of parasites that we generally going to focus on today are the ones that we commonly encounter. There are others, but the main ones would be, so the protozoa, coccidia, different species of coccidia, ciliated protozoa, flagellated protozoa, Cryptosporidia, and then the roundworms, the nematodes, pinworms, tapeworms or flatworms. Again, it's not really an area we're going to focus on today. Trematodes, probably most uncommon one that we do see in captive bred reptiles. They're quite complex indirect life cycles. So intermediate hosts, and just a lot more complex. So we're not really going to focus on those. We've had a few wild caught or long time captive reptiles that have had where we've picked up trematodes. That's an example. It's not a great image. Again, I haven't really got that many images of trematode, but this was a trematode egg. There was a Miricidia inside, and we actually managed to hatch this, and it was proven to be a trematode. So they are out there, but it's mainly wild caught reptiles which we see less and less of as time goes on. The frequently isolated parasites, or the most frequently tested reptiles that we generally receive samples from, would be all the Mediterranean group, if you like, of tortoises, so spur-thigh tortoises, hermans. We get quite a lot of Russian tortoises. They're the main ones. We do see some of the African species, African spur tortoises, leopards, and occasionally South Americans, so red-footed, or all those, that sort of group of Giacalone, or previously Giacalone group of tortoises. The lizards, we generally see, we see lots and lots of bearded dragons. It used to be, years and years ago, it was iguanas were the lizard that were most commonly found in captivity, but now it seems to be the agamic group, so bearded dragons, Rankin's dragon. They're the ones that we test the most. Out of the geckos, we do see lots of leopard geckos, crested geckos. They're probably the most common ones we do see. And the snakes, so quite a range of snakes, different ones from hognoses to boids, royal pythons, so different pythons, boas, quite a lot of colubrids as well, so corn snakes, king snakes. So yeah, they're the reptile sort of samples that we do get in. And the most common sort of groups of parasites that we do see, so tortoises and agamids especially, pinworms would probably be top of the list. So yeah, the different species of pinworms, get into those a bit later on. But in the tortoises, ciliated protozoa, often non-pathogenic, we see lots and lots of those. Flagellates as well, lots of pseudo parasites, so especially tortoises that are in the garden, lots of parasites that are passing through, maybe from birds or other animals. We do see quite a lot of those, and we picked up quite a lot of Cryptosporidia as well, tortoises, and then other roundworms like ascarids, so larger worms. We do see some of those direct or indirect life cycles, but the star, definitely those two groups would be the pinworms. In bearded dragons or chameleons as well, coccidia, we do see a lot of. We see a lot of Isospora in bearded dragons, and other parasites, Giardia, not that frequent. Out of the trichomonads or the flagellated protozoa, we don't really see that many Giardia. Some do test positive, and we have a suspicious sample based on the movements, and the measurement. We normally test for Giardia, and because it potentially is zoonotic too, potentially. So yes, we've had a few of those that have been positive, and then Cryptosporidia and ciliates. And in the snakes, we do see lots of flagellated protozoa, so trichomonads, strongyloides. In fact, quite a lot of these, which are very similar in appearance. The egg with the larvae one inside, very similar to the boid lungworm, the rhabdias. You see lots and lots of pseudoparasites in the snakes, which again makes it very difficult to actually see the significance of these, because you see lots of parasites being passed through from rodents, which obviously is, they're not significant. They're just passing through. They could even be zoonotic, could even be parasites that we pass on to people, but they're not actually parasites that we necessarily need to treat in the snakes. It's sometimes very difficult to tell if they are pseudoparasites or not. And then others, so Cryptosporidia, again, it's an emerging disease, you could say, because we're looking for it now more and more. Amoebas, snakes, again, we don't really see many. You see lots in captive reptiles, or more, should I say, in Spain, in captive reptiles, but in the UK, we don't see that many. So that's basically the sort of groups that we generally see. So pinworms, obviously, they're the star parasite, you could say, of the tortoises and the lizards. They come in all different shapes and forms and sizes. Normally they're sort of D-shape with the membrane. The contents can vary massively. These different appearances. Insect pinworms can look very similar. So pinworms are being passed through from in feces from a bearded dragon, for example, from invertebrates, from crickets, for example. There's not many studies out there that have actually looked into this. That's one of our lines of studies currently. So many of these that have very low numbers, perhaps they are passing through from invertebrates, from crickets especially. And we've consulted with some of the world leading parasitologists, and they do agree that there is a lot of these parasites do look like, or parasite eggs, should I say, do look like invertebrate pinworms and not from reptiles. They can be larvated, as you can see in this image. This 100 magnification of larvated pinworm egg. That's a close-up. Again, D-shaped. We tend to find these quite frequently in crested geckos, quite frequently. And again, they can resemble pinworms from insects too. These are quite common recently. We've had quite a few crested geckos with these. This would be a flotation where we've concentrated these eggs. So they've floated the surface. We've looked under the microscope, and it just concentrates the eggs, which in this case, normally we would have seen these on direct wet mounts initially, and perhaps on a pinworm count. But the flotation techniques really are for the eggs that perhaps are present in lower numbers. So, for example, here, this was a coccidia, for example, very low numbers, not set on wet mounts, but on flotation it was picked up. This is a pinworm egg that has hatched. So here you've got what's left of the egg here. This is the pinworm that's hatched. It's the close-up. Got the bulbous esophagus here. So that's the characteristic of the pinworms. Gets mainly tortoises. We tend to see these in, and even the eggs and eggs that have hatched, we tend to see more in tortoises than bearded dragons. So yes, the treatment of pinworms, again, going back to the same subject again, is more and more there's a lot of the reptile vets around the world are agreeing that it should be husbandry centered, at least, rather than pharmaceutically based or centered. So we don't just see pinworms and treat them. Even the best setups can be improved. The wild versus captivity is just an example of if you have a spur-thigh tortoise in the wild, a male spur-thigh tortoise, for example, that has a nomad life. So he goes from area to area. They travel quite a lot. So I'm looking for females, especially in breeding season. They rarely will stay in the same area. They just travel around, so they don't come in contact with feces, the direct life cycle of pinworm feces again and again. Whereas in captivity, it's pretty much impossible to have an area that's a size where they're not going to re-ingest eggs to some degree. So they can be a good marker of husbandry or environmental cleanliness, you could say. And again, this is a current study we're looking at. We do know we're going to find higher numbers and are more present in captive reptiles versus wild. We're actually over in Spain currently taking samples from wild tortoises and looking at numbers. And so yes, that's again a line of one of our current studies too. So yeah, so just focus on husbandry conditions, which most people nowadays that do sort of keep tortoises, they're pretty aware of what they need regarding temperature, UV lighting, all that sort of thing, diet, cleanliness, obviously. And the setup is the husbandry setup, or the area is something that can be improved. So the size of the setup is quite important. Substrate changes, again, quite important. And the significance of them. So are they, when they present as more in clinical practice with reptiles, if the reptile was sick and we saw some pinworms, and even if they're relatively high numbers, probably wasn't the underlying cause. We have to look at what symptoms obviously they present with, and very often there was underlying disease, whether it was viral, metabolic. That was the most common thing we used to see. The important thing really is just to liaise with your vets, with your veterinary surgeon that's got experience in reptiles. There's more and more vets that do specialise in exotic animal medicine and surgery. There's more and more specialists around the country. I believe there is one specialist here tonight. So it's definitely worth just a conversation, and you'll always take something away from that. There always will be something you'll be able to build on and improve, whether it's husbandry wise or just general health. But it is just a risk assessment. It's pros and cons. If there's, again, going back to hibernation, tortoise go into hibernation with high pinworms, we don't want to treat, well, it should be discussed. It should be, and everyone should be made aware that there is a risk involved. And a lot of the tortoises or bearded dragons that we do see high numbers of pinworms in, there might not be symptoms, but after dosing with some of these medications or drugs, but might not be symptoms we actually can physically see. But what are the white blood counts doing? It's something you just got to be aware of. Yeah, this is the famous medication, obviously, and it is a great drug. It really is a great drug. It just should be used in the right circumstances. And the routes of administration and doses, that's another thing that your vet will be able to discuss that with you and make a decision. It can be given orally. It can be stomach tubed. There are doses that can be given percloacally, for example, in tortoises to reduce numbers if you think numbers are high. So there's all these different ways of administering the drug that again it's worth just discussing with your vet. Yeah, this is we do want the same outcome. That's an important one. We're on the same side. So husbandry-centered treatment. That's the current sort of belief and movement, if you like. And the new reptile medicine and surgery, Dr. Doug Mader, his new book, it's very clear in there too. One of the world-leading pathologists in exotic animal medicine. That's exactly his opinion in this chapter too. So yeah. Other nematodes are the roundworms that we come across quite regularly. So this is a Strongyloides. It's a very small roundworm egg, quite difficult to find, to come across. This is an example on the right of a pinworm egg on the left here. This is a bearded dragon. So it's 100 magnification. This was 1,000 magnification. So pinworm egg on the left, relatively large. Compared to, we can't even see the egg. So if you're scanning through at 100 magnification, we probably would just miss them. But they're often present, and again we do see them quite frequently. So they have quite a characteristic life cycle. So pinworms have a direct life cycle, so they're passed through the feces, they can be re-ingested. These do have a direct life cycle too, but they're more complex. So these little eggs, they can be a larvae one in there, that can be a male or female. They will hatch. They'll be passing the feces. They'll hatch. The larvae one will hatch or molt into larvae 2, 3, 4, and then will turn into what's called a rhabditiform worm or parasite. And these worms are actually, they have a free living phase. And the male will hatch, molt, and they will mate, and then they will lay eggs, and those eggs will turn into larvae 3 again, and then they'll penetrate the skin and migrate through the different systems, body systems, including respiratory system, whether it's in reptiles, in humans, in the Strongyloides stercularis does act in a very similar manner. And then ultimately it reaches the gut and the cycle starts again. Some of the females will actually not turn into free living phase. They will just reach the L3 phase, and then they'll penetrate the skin and in the host, and the whole cycle starts again. So it's quite an interesting cycle. And again, direct cycle, but quite complex. These are the larvae. So this is the larvae one that hatches from the egg. Again, very small. So on a direct wet mount, you can easily miss them. Just over here on the right, but blown up, that's the worm. In the end, we find that the larvae moves inside, and they're pretty much indistinguishable from the rhabdias, so the boid, so python or boa lungworm. And yeah, they look exactly the same, the eggs, so you can't tell the difference. I've had a few cases over the years where there's been boas or python boids with respiratory disease. There's been samples taken, and they were actually not strongyloids, but rhabdias or lungworms. So yes, again, all these parasites are out there. Other nematodes, so ascarids, roundworm, which these from tortoises. Don't see that many compared to pinworms. This is, and again, it's a risk assessment with these as well, because if there's eggs, then you're probably going to have worms, adult worms, and the size of these worms pretty impressive compared to pinworms. You can just imagine a small tortoise, for example, or any other small lizard with these beasts inside them. This is probably Sulcascaris. It's from a tortoise. I believe it's Hermann's tortoise, and yeah, they're pretty large parasites and cause quite a lot of damage. So these ones, even with low numbers, probably need to be treated. Again, it's risk assessment, and it's a conversation with your vet. The ciliated protozoa. So again, we see lots of these mainly in tortoises, bearded dragons, most frequently. So on the left, we have Nyctoterus, which is a cyst. It's about the size of a pinworm egg. On the right is Balantidium. These are generally apathogenic, so they don't cause disease. Balantidium can cause disease. They can be facultative. If there's high numbers, there have been cases where they have caused symptoms, so they need to be treated. But generally, they're just there, and we don't really need to worry too much about them. This is the motile phase, or the trophozoites, it's called. So on the left, you've got Nyctoterus here. On the left, this is actually, you can't really see it very clearly, but that's the cyst of Nyctoterus. So we've got two phases there, and they move. They've got cilia. They've got cilia all around them, and they move by moving these cilia, little hairs around them. And this is Balantidium, which again is the same. They've got little hairs all the way around them, and that's what propels them, or that's how they move. That's just a comparison. Pinworm egg with a Nyctoterus cyst, so they're quite big. To have the name to be called a cyst, yeah, they're quite large compared to other protozoa. Trichomonads. So these are the flagellates, flagellated protozoa, which would include all different species. So from Trichomonas to Hexameter to Leptomonas, Giardia. There's all different species and different sizes, and often there'll be multiple species within the same reptile. We do see quite a lot of snakes with these parasites too. Often the most common sign that we do see is loose stools, so diarrhea or loose stools. So here we have one on the left just here. Again, taking a picture of these is quite difficult. They can be stained with iodine, which is what we normally do, and you can try and identify the species. These are different ones on the right, different size again. This was from a green tree python with a very high load of trichomonads. And movement-wise, there's just all different ones in here. The Giardia are typically the ones, we see them a lot in clinical practice on a weekly basis in dogs, Giardia. Often these samples are sent to the laboratory, and they'll do the Giardia test there. In the reptiles, we don't see that many. And if there is a suspicious type of movement, then we might either send it off or run the sample, the immune sample in-house. Tapeworms, so lots of different. The most common that we do see is Onchoristica. So this one on the left. The tapeworms can be, there's lots of pseudo parasites that can be passing through and not actually causing disease. Over the years, we've had quite a few iguanas with high numbers, and there are published cases with iguanas with very high numbers of these parasites. We treated them successfully because there were symptoms, and there were relatively high numbers of these eggs. This is a hexacanth embryo here on the left. This one is 2, but it's on the right, but it's not so obvious. This is actually from a tortoise. So we do see them, not very frequently. Again, it's the clinical picture. It's what is their lifestyle? What is their husbandry? Are they showing any symptoms? Is it just one, or are there more of them? It's something that we just need to put together. From snakes, we see lots of these, which is a rodent tapeworm, Hymenelepis. So Hymenelepis nana is considered a zoonotic disease, and again we see this in snakes without symptoms. So it just brings back, just reminds us that hygiene, general hygiene, is very important, especially with children, and it's something that's in people, in humans, they're very non-specific signs that are seen, from mild headaches to rashes to loose stools. So it's they're parasites that are out there, and I think I've got a slide here. I think it's a bit later on about the zoonotic consideration of these. We do see lots of them. There's 2 sort of main species, diminuta and Hymenelepis nana, and the latter, the Hymenelepis nana, is the one that's considered to be zoonotic, and just got to be cautious with them. Yeah, really, we should be going back to the rodents, where they got the rodents from, and trying to sort of trace them, and that would be a way to try and eliminate these, but it doesn't always happen that way. So coccidia, lots of different types of coccidia, small protozoa. These are at 1,000 magnification. They're typically very small. They can be. We typically see Isospora and Emeria. They're the 2 most common ones. We do see in rabbits, for example. We see lots of Emeria, lots of different species in those. In chameleons, bearded dragons, we tend to see more Isospora. Occasionally in some of the lizards, we'll see Emeria too. This is an unsporulated oocyst. So there's just one in the center there. And as they're left, often more frequently it's a couple of days, so 48 hours, then they will sporulate, and then you'll find, so in the case of Isospora, there's 2 sporocysts that you can see here, and inside there, we can't see it with direct microscopy as we're seeing here, but inside each one there'd be 4 sporozoites. So that's the formula, if you like. There's 1 oocyst, 2 sporocysts, and 4 sporozoites. So you can say that it is Isospora. Actually figuring out which species it is, that's obviously something that can be done with PCR testing, genetic testing. It's a more advanced test, which usually isn't necessary. In bearded dragons, we do see they have a very specific type of Isospora, coccidia, which is Isospora amphibolari, very frequently encountered. This is a flotation technique here, and that's all the Isospora with 2 little sporocysts in the center. They're very round. That's the typical presentation, what we find on direct wet mounts. Then we get into all the other protozoa. So again, these are relatively rare compared to all the others that I mentioned. Cryptosporidium is, again, we could call it an emerging disease, only because we're testing for it, and we're picking up lots of different species of reptile now that will carry it. Some will just carry it, others it will be specifically causing disease. The ones that will carry Cryptosporidia, so for example snakes, it can be a challenge, especially the first ones, the relatively first ones to be diagnosed were the corn snakes with the mid-body swelling, and so a lot of the snakes that are tested that do have Cryptosporidia. Again, it could be a reptile-specific Cryptosporidium, or it could be a Cryptosporidium that's been passed through the feces from a rodent, so from the ingested prey, which makes it a challenge, especially for a breeder. If a breeder sends the samples and they come up and they test Cryptosporidia positive, then usually it's PCR testing that we send off for once we've confirmed that they are there. PCR testing is, although it's fantastic and it can tell you exactly what species it is, the world leading laboratories, the actual numbers that they have, some of them up to 50% will be negative on PCR, and then they'll have positive stains or positive ELISA tests. So it's something that we just have to consider. And yeah, PCR testing is fantastic, but a combination of tests is usually needed. And some of the biggest laboratories in the world do that. They have at least a couple of tests, so 2 tests to confirm they are there. Just because you can get false negatives. With all the tests, you can get false negatives. Species-wide in the reptiles, so there's 3 groups, you could say. The rani, which used to be called Saurophyllum, is the one that typically found in lizards. It has been found in corn snakes too, so it's not specific to lizards. It can be found in other reptiles. Cryptosporidia serpentis is the one that we generally see causing disease in snakes. These have been detected also in cattle, so again, can go from one species to another. Perhaps a pseudo parasites, possibly causing disease. That's not very clear. And then the tortoises, recently, there's two different species. So there's tortoise genotype 1, tortoise genotype 2. Tortoise genotype 2 has been found in chameleons also. So that again, just throws a spanner in the works. It's and very similar with Cryptosporidia tortoise genotype 1. It has been found in ball pythons. So it's not always, it doesn't follow, they're not species specific. Again, Ameria, we see a lot in wild caught chameleons, lizards. That's the other type of coccidia, often cause disease and do need treatment. The other types, Isospora, a lot of the bearded dragons will just carry low numbers and don't necessarily need to be treated, although they can cause disease and severe disease in very young bearded dragons. So often in clutches, that's in hatchlings, that has been reported. Immune suppressed reptiles as well, immune suppressed bearded dragons, maybe with underlying adenovirus, which isn't always diagnosed. Giardia species, we said previously, there's different types of Giardia intestinalis. We don't see that many. The ones that have been diagnosed and have had symptoms, they have been treated just because of potential zoonotic risk. And the amoebas, so Entamoeba invidens is a pretty nasty amoeba, very difficult to treat. There's high mortality rates. Again, abroad, you see quite a lot of these. The UK, don't really see many in captive bred reptiles. This is an example of one of the amoebas, which again we don't really see very often. It's just here in this characteristic movement. It's the amoeba movement there. And then pseudoparasites. So pseudoparasites, extremely common, extremely common. On the left, for example, we have a mouse mite egg, which not a parasite, nothing needs to be treated. Simply something that's found on a fecal exam, and it's got no significance whatsoever. There's some false positive Cryptosporidia stains with a modified Kinyun stain on the right, which are not coccidia, not Cryptosporidia, sorry. They're just artifacts. So every test has limitations with staining, and false positives can occur. That's always an issue with any testing. Mites, environmental, so fecal environmental contamination. We find quite a lot of these, so we just normally report them and just say, yeah, we found these mites, report them, but it's not obviously an intestinal parasite we're worrying about. And then pollen is seen it time and time again, where they're diagnosed, reptiles diagnosed, especially tortoises, diagnosed with ascarids, relatively high numbers, no symptoms, and there's pollen being passed through, which is something that, again, just got to be very careful of, because if we're trying to treat pollen with Panacure, it's probably not going to work. And the only outcome that we may see is immune suppression and then potentially bacterial, viral, fungal flare-up. So it's something that, again, it's just has to be put into context and can be very difficult, can be very challenging to actually differentiate. So from a public health point of view, so zoonotic risk, so parasites being passed on to people. It's not just about salmonella. Like years and years ago, there were the red-eared sliders that were imported, and there was the risk of salmonella being passed on to children because they're from them in their mouths. They limited the imports, and then they just started importing different species, and it just went on from there. It's not just about salmonella. There are other parasites that can be problematic. Cryptosporidia shouldn't be overlooked. In Testudo tortoises, there was a group of 5 tortoises, and through genetic characterizations, they proved that the Cryptosporidia that were found in them were actually identical to Cryptosporidia pestis, which is zoonotic, does cause disease in people. So Cryptosporidia shouldn't be overlooked, and it's something that is out there, and we just got to be cautious. Similar to Cryptosporidia found in dogs and cats, so Cryptosporidia felis or canis can affect people with acquired immunodeficiency syndrome. So with AIDS, that can be an issue. So it's something, again, just got to be very careful of. Hymenelepis, this is the one that's passed through with rodents and snakes. And this was a publication from a Journal of Microbiology, and in 2015, calling them neglected zoonotic helminths. So neglected zoonotic, so they are out there, they can cause problems. And worldwide, Hymenelepis now does cause issues. Captivity from reptiles, there's no numbers from the actual disease in people, so we don't actually know, but we know it's present, it is around, so again, just got to be cautious. Then there are other diseases like different tapeworms, spirometra, pentostomes, tropical countries, or not seen in captivity. So they're out there. We don't actually find them in the UK, so it's not really an area of focus today. And Giardia, as you said, relatively rare, but they are out there, and just got to be cautious. It's the cycle. Hymenelepis nana taken from the CDC. So it just shows the rodent and the person, the cycle. So the egg that can be passed on to onto humans. There's the Menuta, which is slightly different. So the cycle actually does involve certain invertebrates. So the one that we're sort of more worried about would be the Hymenelepis nana. Okay, so that's, I think, basically all we wanted to sort of go over today. So if there's any questions, feel free to fire away. I'll start answering some of those. And yeah, I did just want to release a poll, if that's okay, about parasite testing. So how often do you test your reptiles for intestinal parasites? It's quite an interesting one, because traditionally in dogs and cats in Europe, we tend to start antiparasitic programs or preventative treatment, but we don't actually test very frequently, unless there's a problem in clinical practice. So a lot of the veterinary practices, you'll see that they have different care plans, which include treatments for different parasites, including lungworm, obviously, as preventative treatment, but there is the option for testing out there too. My understanding is that in the States, they actually do more testing, flotation techniques, actually looking for the parasites, and then they will treat them as needed. That also does help with resistance too. So in the UK, or in the rest of Europe, if we're treating with antiparasitics, in a way we are contributing to resistance instead of just treating as needed. So it's quite a combination here so far. So most people are saying that they'll test once acquired or purchased as an initial screen, and then the other 3 are very similar. So about half will just test once they're acquired or purchased, which again is a good idea without a doubt. But it's more if there's a negative result, there's no symptoms. It's more numbers that could be increasing and could potentially cause problems. That's the real reason why sort of testing if there's been no other introduction of reptiles into the collection. And for breeders, quarantines and testing is obviously very important. That's something that obviously should be done. Okay, so if anyone has any questions. Okay, so there are a couple of questions coming through. So can crickets pass on pinworms to bearded dragons? So crickets, there was a study a while ago where they tried to prove that crickets could pass on these pinworms to bearded dragons, and they didn't succeed in proving this. There's probably more work than it needs to be done, and they're probably not. They probably shouldn't be considered as an important source of the eggs in the environment or in the prey, but they could act as amplifiers. They potentially should be considered as potential carriers of pinworm eggs. They eat the feces, and then bearded dragon ingest them. They can carry on. They can pass through, but there are also pinworms found in invertebrates, in crickets, that look like the parasites or the pinworms that you find in the reptiles and aren't identified as invertebrate pinworms. So there's a lot of work to be done, and that's part of our focus currently. Okay, there's another one coming through too. So how often should I treat my reptile against parasites? So that's a good question. It is something that's in dogs and cats. There is the Companion Animal Parasite Council, and also the CAPC, which is very important. It's out there, and there are people that we should be listening to. There's also the European Scientific Council of Companion Animal Parasites, which they're the ones really that are advising either governments or vets in Europe, and again, we should be listening to them. And they do recommend that in dogs, for example, that we test up to 4 times in the first year, which we generally don't see in practice, and then after that, a couple of times a year. So if you extrapolate something like that, so similar to that to reptiles, once or twice a year, and when you acquire new reptiles, probably a very good idea. So yeah, that's probably, so once or twice a year is my opinion. And if it is a hibernating species, then we just got to be cautious and just try and just in case there is a positive result, we do need to treat. Just have a window, a gap, a few months gap where if there is a potential issue with immune suppression, it's actually resolved before they go into hibernation. Okay, so we've got a question from Kaz asking, what extra standard testing or treatment precautions would you recommend for wild caught animals, internal or external? So I think for wild caught animals, we still test for a relatively high number for wild caught animals still. And I think the probably most important thing would be a experienced reptile vet for a clinical exam. That may show up external parasites which can be treated. Again, quite relatively common. Whether it's a lizard, a snake, or tortoise. We tend to see more lizards wild caught than any other group of reptiles. And then the parasitology testing really is a comprehensive parasitology test, just for including sedimentation, so flotation sedimentation. So just bearing in mind there could be other parasites with indirect life cycles. So, for example, trematodes or cestos, a tapeworm. But other than that, I think the clinical exam and the conversation with the reptile vet really is the important part of it. And then obviously wild caught animals suffer more from stress, so having the optimal husbandry conditions extremely important. Extremely important. A lot of reptiles that we see in captivity that are brought in are actually reptiles that do very well under stress, under captive stress. And that's why we see so many of them. The ones that don't do so well, we don't really see many. So it's something that, yeah, I think just a standard parasitology testing and clinical exam, and then if there's anything specific to the species, then that can be obviously be discussed. And if it's going into a collection, obviously, then there can be viral tests that can be done, but it's not species specific. Okay, there's some more questions coming through. Okay, so Jill, hello Jill. Is there any way of disinfecting outdoor tortoise enclosure? That's a question that's asked again and again, and it's a difficult one, very difficult one. Because if there's an outdoor tortoise enclosure is something that if you start putting products on there, and then you're putting the reptile, generally tortoises, putting them back in that environment, so you've got to be very careful because there could be toxicity issues. If it's a small environment, things like boiling water would be very safe, obviously with the tortoise outside of the enclosure, but the toxicity would be the main issue, and changing substrate or boiling water in a small environment. But outdoors, I think it's really hard. I think it's very, very difficult. I think we have, there's one of the exotic vets on here. I don't know if she can maybe add to that, but I think it's tricky, very tricky. If it's a garden, and it's tortoise going in the garden, then the likeliness of, if there's pinworms present, for example, the likeliness of that garden amplifying or increasing those pinworm eggs is actually really low, because the load will be very low and they'll be present anyway. So I don't really think it's a major issue. It's more the day-to-day enclosure or tortoise table cleaning that's needed, because it's a direct life cycle. So they poop, they trample, they eat, they go in the water, they ingest. It's so quick, it really is. And having not many pinworm eggs in the environment, it's not going to be really a big issue. From the point of view of other parasites, it's always a risk, just like it is with dogs or cats or even humans. There's always a risk. I think it's a tricky one, I'm afraid. Yeah. Okay, so we've had the answer from the exotic animal specialist here that's also connected today. And she says that she does agree, outdoors is difficult. In extreme cases, she will ask people to remove the top layer of soil and boiling water. So there you go, that's something added to that. Yeah, thanks for that. Okay, so this is the first of a series of webinars. My first webinar, so it's run relatively smoothly. But there will be more on different species, different parasites, and it's something that, again, I'm really passionate about and interested in. So yeah, so if there's any questions, you can always email the Reptile site. That's the easiest way, probably. And yeah, thank you very much. If there's anything else, I'll wait, see if there's any further questions coming through. Okay, there's a couple saying thank you, so you're more than welcome. Okay, so yeah, so I think we'll stop here then. So any further questions, just email. Yeah, and it's been a pleasure talking tonight. Okay, see you.